Good afternoon. This is Dr. Nilanjan Dutta. I'm a pediatric cardiac surgeon. I work in the Neotia Bhagirathi Women and Child Care Center in Newtown. So I'm a pediatric cardiac surgeon. That means I try to fix the heart which are structurally abnormal. So structurally abnormal heart means the heart which are the abnormal since birth. There can be many abnormalities, and it is not easy for me to cover the entire gamut of the pediatric cardiac surgery within a very short period of time. So I will focus on a very particular situation which is not very uncommon to happen, and that is a baby is born with low oxygen saturation. We call them blue baby. In layman terms, that is called blue baby. In medical parlance, we call it cyanosis. So if a baby is born with the blueness, that is a red sign. That is a red flag definitely for the treating pediatricians, neonatologists, whoever it may be. And that baby needs an evaluation by echocardiography. Now, there are three situations which can give rise to the blueness in the baby. The one situation, the first, we call pulmonary atresia. Pulmonary atresia means that a particular artery arises from the right side of the heart and it goes into the lungs. Normally it happens. So when that artery is blocked, we call it pulmonary atresia. That means no blood is flowing into the lungs, and therefore the saturation of oxygen in the body is very, very less. So this situation is usually dealt by the pediatric interventional cardiologist, not by me. Mostly 80% of this situation can be dealt by the pediatric interventional cardiologist, and the process is called ductal stenting. It is very important to understand for the parents that this patient will require the future operation, open heart surgery, maybe at 6 months or 7 months of age. That is an imperative, that is obligation. The number two situation, which is also very common to happen in children, is we call TAPVC. TAPVC means total anomalous pulmonary venous connection. Now, if I summarize, usually two vessels from each lung, that means two vessels from the right lung, two vessels from the left lung, they come and open into the left side of the heart. In TAPVC, rather than falling into the left side of the heart, they come to the right side of the heart, and that gives rise to severe cyanosis. So this is a very emergency situation, and the child has to be operated as and when diagnosed. The weight of the child does not matter, the age of the child does not matter. It has to be operated as soon as the diagnosis is made. So after the operation, obviously all these children will remain in the ICU. The post-operative courses are very complicated, but once the child goes home, then probably they are almost cured for the life. So this is the second situation. The third situation which we come across, we call it a TGA. TGA means transposition of the great artery. So here what happens, again, normally from the right side of the heart a vessel arises and it goes to the lung. From the left side another vessel arises and it supplies blood, the purified blood, we call it oxygenated blood, to the entire body. In TGA the situation is just the reverse. So the artery which was supposed to arise from the left side of the heart, it is arising from the right side and vice versa. So this is again a situation which needs to be dealt with very early, within 21 days of life. Now sometimes it becomes very difficult to wait till 21 days because the child will remain severely cyanotic or blue. Sometimes the kids may require ventilation. So it is not very prudent to keep the child on ventilation till 21 days of life. So in that case, sometimes we need to do a particular intervention. Again, this intervention is done by the cardiologist, interventional cardiologist, not by me, and that is called BAS, balloon atrial septostomy. So this is a procedure by which I can buy some time so that I can do the operation maybe at around 10 days of life or 12 days of life. And it also gives an opportunity to the kid to come out of the ventilator and to become stabilized so that I can do an operation. It's a big operation on a stable kid. So similarly, the post-operative courses of all these kids are going to be very, very tough, very tempestuous course. But once they make it to home, they are almost cured for the life. So if I can summarize that when a child is born and present with the blueness, then we have to, the first thing is that we have to make a diagnosis. This is not a normal situation. There is something abnormal in the heart itself. So an echocardiography is definitely important. and then the diagnosis. And if all these diagnoses are made, then the child needs to be intervened either surgically or by the interventional cardiologist.